This is Tuesday, not Super Tuesday, but this is our Healthcare Tuesday. And this is our weekly talk about healthcare and specifically coronavirus from the standpoint of our medical practitioners, where we get insight, feedback, and we talk about some of the latest with coronavirus over the last week. And we dig into and analyze. And lately, it's become more of a deep dive in trying to really understand, the perspectives of our medical practitioner community, and also rolling back those perspectives into a world of the future where we can hopefully be out of this situation where we are in today. Okay, so let's get going. Governor Gavin Newsom made the news. Essentially, there is a push with many of the different states to get back to normalcy, and everybody's sort of taking baby steps towards that. Some states are a little bit more aggressive, but I like the plan that Governor Gavin Newsom has come up with. And on Friday, we will go to stage 2. And by stage 2, we are talking about removing the restrictions with some of our businesses. That includes like book and clothing, music, sporting goods, as well as florist right in time for Mother's Day. So that's Gavin's plan that he's put forth. It does not apply to restaurants, and it does not apply so restaurants, you can still do takeouts. We also have it does not apply to offices, it does not apply to shopping, malls or schools. So it's a little, it's like we are opening up just a little bit, as if you had a little screw and you have like loosened it just slightly while we check it out in terms of will it withstand the pressure or not. So I think that's what is going on. And more than 2,282 Californians have died from coronavirus in the state of California. And nearly 56,000 have been confirmed to have it. So that's a pretty large number, 56,000. And that is in the Bay Area counties, which is about 10 counties. And we in Santa Clara County, we have a total of 2,244 cases and 117 deaths. And so far in Santa Clara County, we have had 33,000 tested with about 2,200 positive and with about 30,000 negatives. So quite a few, massive number of negative results, which is probably okay. So there has been a couple threads that have been going on in my social media that we would like to talk about. But let's finish up this talk about Governor Gavin Newsom. So the plan is in stage 3. Essentially, we are going to roll out a process to look at some more businesses to be opening up. That includes like hair salons, gyms, movie theaters, and church services and things like that. So I think when we hit stage 3, we'll probably be in a good shape. And the question is, will we hit stage 3 like next month or in a few months? And something tells me that it'll be a few months before we hit stage 3. And stage 4 would essentially be the end of all restrictions. And so one of the things going on is with California wanting to do contact tracing. And so the state has apparently rolled out a plan to hire a bunch of folks who would be the contact tracing resources for the state. And so that process is currently in place. Now, I really wonder, how they would do it with people. It's more of a technology issue. So I'm kind of missing out on Governor Gavin Newsom's plan with this, but it's okay. We'll see how that comes along. And so there is a training program that is currently happening. And so that is the latest. Now let's start with something, a topic that we'll talk about, which is related to the fact that the California Hospital Association, there's been a $16 billion loss with how we have sort of put on hold some of the surgeries that were supposedly supposed to be happening and as per the timeline. And we said, okay, let's free up the resources in the hospital. And so those elective surgeries and procedures were cleared up in anticipation of a flood of coronavirus patients. And that never came. So that would be the first topic we'll talk about. But let me introduce our panel here. And we have Dr. Scarlett also joining us. So let's go through a quick introduction of everybody here. So we have Dr. Harsha Ramchandani from the Tri-City Hospitals, and it's based out in Fremont. And but with the new situation that has happened with her organization, they are merging, and so she'll have different other hospitals that'll be part of a bigger, larger family, and that includes here right in the city of San Jose, and so also Gilroy. So there is some sort of a merger expansion happening, so that's good news. Thank you for joining us, Dr. Ramchandani, and then we also have Dr. Daisy Scarlett MacCallum, and she's the Occupational Health Clinic, University of California, Berkeley, and Health Services, UC Berkeley Health Services. It's great to have Dr. Scarlett MacCallum back. And then we have a regular, my dear friend, Dr. Rakesh Behl. He's the hematologist at Sutter Health. And so that's our team. So let's talk about the situation where we hear that many of the elective surgeries were put on hold. And then we see that many of the medical staff had to go through furloughs to brace for that. So sort of like some of the medical practitioners that were not involved with some of the with specifically to coronavirus, they were basically furloughed, and that's obviously impacting a lot of people. And was that the right decision in terms of planning for a spike that seemingly never happened, and then we basically to some extent, if we had approached it in a much more sort of data driven or a more granular perspective in terms of what could happen, what could not, and foresee a few different scenarios, we might have potentially adjusted, and the $14 billion loss that the California Hospital Association is talking about may not have happened. So let's start talking about that, and let's dig into that.
So Rishi, I can start with this topic, and it's a big burning point for all of us. I just want to clarify, I work in a clinic setting, which is an outpatient clinic, but I work closely with the hospital, and Washington Hospital is the closest hospital here, as well as with the Highland Hospital. And I've been hearing this problem. There is, because of the elective surgeries not happening, the hospitals are losing a lot of money. That's true. And this whole planning which was done was because of the spike. And I want to say this is a fortunate situation we are in, that we did not have the spike. I mean, I'm really fortunate, being positive about it. And I think it was better to get prepared rather than not being prepared for the situation. If we look at the other side of this, is that there are a lot of asymptomatic carriers. Right now, we are finding it out. A lot of patients, they're not symptomatic, and we test them out, they're positive. I just heard one of the pregnant patients was admitted to the hospital, and it's a policy now for the hospital to test every single person being admitted to the hospital now. And there are a lot of asymptomatic people coming in positive. So I'm just thinking, if we would not have done this, we would not followed these guidelines, there could have been more deaths, and it would have been a bad situation, I'm thinking. So although there is a loss, but at the same side, on the other side, I'm thinking maybe it was a good decision. So same stands for the clinics also. As I work in a clinic, I manage patient providers. We have like 120 providers right now in our clinics, and we have gone down on our productivity to almost 50%. Even the regular physical exams, we are not seeing at this time, and we're losing money. And being a safety net clinic, not a private clinic, it is a challenge for us at this time to keep the doors open and not furlough people. So there have been some decisions in furloughing some of the staff, especially the vision clinic providers and the dental providers, that we have taken the action. So it is a hard hit on each and every single area, not just the grocery store, not just the businesses, local businesses, but also for the hospital and the medical setting. COVID-19 has hit hard, all of us. But if we would not have done this, what else could have we done? I think it's hard for me to tell at this time.
So the perception is that the healthcare industry is doing phenomenally well. That's the perception. And then when you really dig in, I don't think so it's doing that well, because I've heard that some of the ER centers are completely empty. Nobody's going there because there are no, there are kids not playing who are they're not playing basketball, so they're not like spraining their ankles or whatever else. So, there is no demands. I mean, there are no road accidents happening. So essentially, it is impacting businesses. But that's the case pretty much with all over, right? I mean, every business has been impacted. And then when we look at the adjustment, I heard this. I was talking to a student, and apparently the father, his company was dealing with some sort of a drug research, and they have all sort of diverted their energies into handling coronavirus. So a lot of resources in America have also been diverted to find solution, and who knows what's going to happen. And typically what I've seen is that with some of these like search for vaccinations, the moment the SARS virus was gone, the quest for that vaccination also sort of vanished away. So we are sort of been derailed a little bit, but hopefully it's the right reason. So any other comments from some of the from Daisy or from Rajesh?
So my comment is, I work in both a clinic and hospital setting. I work in Berkeley, and we have been impacted not as much in my particular specialty in oncology, because oncology is a sort of an pressing issue and people don't put it on the back burner. But if you were to consider things like cardiology and neurological issues, people have ignored strokes, they've ignored their chest pains. And these are people who probably needed real services and have not contacted doctors. Patients who may have needed surgery sooner have not been allowed to go ahead with elective surgeries, but that impacted the business of healthcare, but it's also impacted health of the individuals to some degree. But I echo Dr. Ramchandani that had we not done this, what could we have done? Now, we know that certain hospitals are hurting more than others. Now, those in big metropolitan areas, they still were able to cope with COVID, and they had surge of COVID patients. But the hospitals that are hurting were told to stand by for COVID in, say, a rural area, and they never got the surge, but they also stopped seeing the patients they would normally have seen. So those are the ones that are hurting financially, and their employees are hurting because they were furloughed or laid off or told not to come for a while, or their hours were cut. And it's not so much the doctors that are hurting, because they usually have some reserve and they're higher income. But the employees who are clinic assistants and nurses, they can feel the pinch, and some of them can be financially on the living on the edge. So that's the impact. But again, in a situation that was rapidly evolving and we did not have testing, so there wasn't the data with which to move, I don't know what else the governor or the bodies could have done, as Dr. Ramchandani said. And we're lucky we did not have the surge. We're lucky we're not in the same position as New York or New Jersey or Italian hospital, and we should be grateful for it, and then look at how wisely we can re-escalate without causing a problem or a second wave, and then be prepared to deal with a second wave. Perhaps when we deal with the second wave, we may say that the authority would be decentralized at a county level, and the county leaders can decide how best to utilize their resources. That's a general thing I can make. I'm not in the business of administering healthcare. I mean, but that's how I think might happen with a second wave that I hope will not happen.
Yep, yes, we can certainly hope for that. But if you look at the data around this, there was an editorial by the San Jose Mercury News where they were actually talking about the 1918 Spanish influenza. And apparently with the second wave surge, thousands basically, unfortunately, died in the Bay Area. And then we also see a draft government report that came from Washington that basically is talking about potentially a sharp increase in COVID-19 cases and deaths nationally beginning around mid-May. So we may not be through this yet. And so, is there a sense that we are sort of moving too fast? And should we have more of a caution compared to what we have? So I think there's obviously, as an elected leader, Governor Gavin Newsom and the governors from every state are feeling the pressure that, okay, the all the different industry groups are calling upon them, just like the California Hospital Association. We have a $1 billion loss. We have issues with, like, yesterday morning at 6:30 a.m. I was pinged by somebody, and she said that her hairdresser was under pressure because they have not had an income and they are being evicted. The landlord is breathing down their neck, trying to see how they could come up with the rent money. So those are challenges that are happening, and there are no easy answers, because the bailout funds from stimulus package didn't quite hit some of these really small businesses, and then we had some county resources that kind of evaporated very quickly. So that's been a struggle. So how do we balance it out? But let's hear it from the medical practitioner standpoint. Let's forget about the economy. Are we moving too fast when we talk about level 2, which will start on Friday here in the state of California?
So we know, based on like the epidemiology of the disease, that 30% of the cases worldwide belong to the United States. We know that there are different types of testing, and unfortunately the antibody test, even though they just released that more testing is going to be FDA approved, we find that there are really 2 antibodies that can really help in determining whether or not there is some sort of immunity, although we still don't have enough data to even presume this. We're just still kind of working out the quirks to making sure that the test works, that it's sensitive enough to pick up what it's trying to pick up. So there are a lot of antibody tests out there that just test for the antibodies that are what we call like the mature antibodies, the antibodies that developed. And at day 20 of symptoms, we know that this test becomes more sensitive. There is literature that supports, if you test for the immature antibodies and couple that with the more mature, then you definitely do have more of a sensitivity that you can really tell what your immune response is. And that's a really good test, so that when the vaccine does come out, you can monitor the patient's or person's immune response to it. UCSF just got a grant in terms of serial testing, which is exactly what we need. We think that it's 5.5 days for that incubation period. And then we think that 10 days after symptom onset, that you have the viral shedding. After that, there's not so much of the data that supports that. So that we're finding out more information. But they say that if we're able to test every 3 days individuals, we're able to obtain about 90 to about 99% of everybody that has the disease. So with regards to opening up fast or not, well, that depends a lot on how much we're able to test, and how much of the manpower we have to test, and how much time people are willing to go in to get testing. There's so much tests out there that are trying to make it really convenient with home testing, or testing that can be done under the supervision of some sort of health practitioner. We know that the Abbott test, which is that test that takes 15 minutes, works well with people that have symptoms, but doesn't necessarily work really great with those that are asymptomatic. And the best test for that is the PCR test, which takes 48 hours to get the results back. So we're running into a lot of almost science-related issues about getting tests done, and getting tests done quickly, and get testing done that targets really what we want targeted, so that we can give back information to the people about saying how effective they are. That's why there are so many studies that are coming out, like 10 days ago in various different journals, that look at placebo, so people without any type of drug versus other type of antiviral drugs, or like that plasma people's own antibodies and being transfused into people that are sick, and looking at all that data. And there's stuff that's coming out of China that's really promising, as well as Italy. You know, I read recently that we're now having more infectious strains. I mean, it's just ongoing and ongoing and ongoing. And I think in the medical community, we worry about, you know, the vaccines and the treatments and the diagnostics that are looking at the virus that happened, you know, in January and December, and then now seeing the majority of the patients that have symptoms that are in the hospitals have this other type of genetic strain, and whether or not the stuff that we've been developing will even correlate to that new more intense virus. It's a big question and a big unknown, and you know, at times it can seem very dismal.
Very true. Very true. You know, I mean, you make a great point, Dr. Scarlett MacCallum. You know, when you look at, for example, the testing, what we have today, the testing capacity is at about 25,000 tests per day in a state, in the state of California, with a population of nearly 40 million people, which is equating to about 62 tests per 100,000 people. Whereas, you know, there was a report by Harvard University where they basically said that testing should be about 150 per 100,000 people. So we are doing only about 40% of where we need to be. So, you know, I really don't know why we have not been able to move forward. It seems like everybody has changed the business plan. The industry folks who are in this type of business, you know, when you look at this non-invasive sensor that came up, where you could put it right, you know, where the, what do you call it, to track the coughing and breathing problems. You know, it's basically, what do they call that? It's basically the point of the throat where you can actually monitor the airflow. You know, you can, it's probably the most sensitive area of your throat, which is where they can apply that sensor, and you're now able to sort of get a sense if you have the coronavirus based upon your breathing pattern. So this is innovation happening. But at the same time, why are we not able to get the testing going? I mean, that's like a huge concern that we have had from day one, and that continues to be the concern today. So I'm struggling with that.
So the answer is simple, if I may add, that it's just we started out late. We don't have a coherent testing strategy, that we ignored the problem for a long time in this country as opposed to other countries, because the first case in South Korea and US hit on the same day. And the CDC's response wasn't very coherent, and we did not evoke the Defense Production Act and certain other things that could have been done in the past. And then we had there were 10 players that were coming up with different sorts of tests. And if I just talk of the antibody test, and they needed to be validated by the FDA, and the process itself was quite slow initially. So the whole thing was not concerted, and I think that's where a pandemic response team could have coherently coordinated this thing and make it happen faster. So basically, when you lose a month in an infection that is exponential, that's a huge amount of time wasted. And that, I think, is the crux of the thing, that we were late to the game.
Yep, absolutely. And then when you look at, when we look at our Governor Gavin Newsom, with rolling out stage 2 on Friday, we have some of the other states that are really far ahead of what California is doing. When you look at Alabama, Georgia, Florida, Ohio, South Carolina, Tennessee, Texas, they are already like at stage 3, looks like, because you look at Georgia Governor Brian Kemp, he's opened up movie theaters, he's allowing hair salons, massage parlors, bowling alleys. And so it's, to some extent, it's good that someone else is ahead of us, just like, Korea was ahead of us, China was ahead of us, and we are able to look at their data to apply that. And even though this is America, we are sort of all connected, but I think it's okay for some other state to experiment, and we can sort of learn from that. It's not right. I don't believe what Georgia is doing is right today, but if that's really the plan, then let's figure out what happens with that. It's almost seems like it's a giant experiment of sort, because nobody has the answers. And I wish we had a better sense of applying different algorithms, software, or whatever else, systems in place that are able to come up with better answer, whether it's like economic models or even whether it's a predictive model with respect to healthcare diagnostics and things like that. We are not there yet today. So do you see an evolution happening with respect to rolling out better solutions? Like obviously right now we are all sort of channeled into the coronavirus. Is that a good thing in terms of how for the industry, for the medical industry, in terms of how we evolve and how we are going to address some of the other challenges that are now sitting in the back burner? Is that a good thing or a bad thing? I'm sorry, I included a bunch of different things in here.
So, Rishi, I can add to that some of the points. So I want to add, like Dr. Behl was right on target that we were late in starting the testing, and but right now I want to address this question that we do not have issue with the testing supplies at this time. UCSF has created the test on its own. Stanford has Quest LabCorp. So I think we should be able to do the testing, and Alameda and Santa Clara Department of Public Health just changed the guidelines to include the asymptomatic people also in the testing requirement. Initially, we were told not to test the asymptomatic people.
Yeah.
So going to your other point, you were saying like, how are we going to evolve out of this whole pandemic? What are the positives to look for? So I think that one of the big things that we have done so far is telehealth technology. So especially in the clinics, it was for Medi-Cal or Medicaid, this was not a reimbursed visits with the telehealth. And we were advocating for it for a long time because we know that with the telehealth technology, we can achieve a lot. And I see this as a positive opportunity with the COVID-19. Now we are doing almost 80 to 90% of our visits as a telehealth visit. So I hope it continues the same, and I hope Medicaid recognizes the importance of this and in the convenience of patients' home, and we can manage a lot of things without having them come into the clinic. And I think we're just getting more resilient out of this. Once we come out of the COVID-19 situation, I think we'll be better prepared for any other situation.
I think to add to that, there is obviously testing is huge, but we need to do better, have a better test, have more data to create a better test. What does it all mean? And I think that's just going to be with time. And, we're data driven. So if we don't have enough tests, that's one thing. If we don't have enough patients who want to get tested, that's another thing. And then in addition, just coming from an economic standpoint, especially as a medical professional, having been told, well, as long as you don't have a fever, you can come to work. So our society is not really in the line of promoting people to stay at home if they're not feeling well. And I can just see I think that in order to move forward, the whole infrastructure of businesses and promoting, more sick leave, more vacation time, or whatever it is, because people are not going to want to stay at home if they don't get paid for it. People are not going to stay at home because they're worried about somebody else's welfare if they get them sick. It's just a cascade of things. So businesses have to change their model and allow for more sick leave, paid time off, and not in a way penalize those that, are not feeling well to stay at home. And I think that that's another part to this whole coronavirus that really sheds light into how really businesses treat their employers, and trying to make it a safe working environment. And I think that that is something that, will have to be addressed at some point.
And to some extent, I think, Dr. Scarlett, MacCallum, when you talk about this, we are, for all practical purposes, we are a capitalistic economy. And, businesses are going to be looking out in terms of, how we are going to protect our profit models, how we are going to protect our revenue models. And that really drives behavior. And nothing wrong with that, because this is how the American culture is in terms of how we run our different businesses, right? But it seems like there has to be some sort of an evolution, and we won't get there. But we have to have the larger the interest of the people, the larger good, and that philosophy has to be rolled into our business models. We don't have it today, and in the context of the coronavirus world, it's quite stark. It's quite clear that we need a better option because the options that we have today don't quite work. Now, we have this type of situation once in 100 years, but do we need to react to that and create better models for the well-being of Americans all across the United States? I think this is the time, and so in fact, I was doing some reading that is going to be part of our new op-ed piece that we are working on. It's about the new order that has been established. There are changes happening all over the world, and businesses will have to morph and adjust and figure out, how we are going to make it work for our American economy that still provides a social net option for a lot of the folks that are essentially suffering right now. Dr. Behl, would you like to comment on the previous thread that we were talking about?
I actually completely agree with Dr. Scarlett MacCallum, and it's something that we really need to explore. It's a reckoning. It's a time of reckoning, and I think that unless we incentivize good health and good health of a company should not be a quarterly profits, because the problem is that a CEO should not be rewarded for what he does in a single quarter. It should be what he does over a period of time and in a longer term view. I'm not sure it's in the interest of the health of the company to have sick people who make other people sick, and at least in a pandemic situation. But even otherwise, even let's say it's not a pandemic, it's good to have a healthy workforce and to respect that. There is no incentive for a person to stay home if they cannot if they're not going to get a sick leave, and they're going to come to work and they're going to make other people sick. That is an infectious disease. But even with a non-infectious disease, it's just not good for the spirit and health of a company to have to force in a way sick people to come in or disincentivize for them to take time off. So that's and I think in some ways a single payer health system, and which is a four-word phrase, which may make some hospital businesses and insurance companies nervous, is something we really need to explore, because this is exactly what's happening now. It's in a sense a single payer health system where a government is trying to take care of everybody by paying hospitals and paying people. And this is something, if we always had it, then we would have less of an issue. And this becomes a politically contentious topic. And I know many people would like to go there, but somebody should explore it and model it. What if we had a single payer health system? Would our response and outcomes, would have they been different?
Yes, because that's a really good point, Dr. Behl, because when you look at South Korea, they have a single payer system. And apparently the system they have created is like a Stanford healthcare system. They have really created a top-notch healthcare system that works for their citizens. It works quite well. And the early days of the first week or 2 weeks, they had quickly rolled out drive-through testing. That only happened like 2 weeks back here in Milpitas. So it took us, in Santa Clara County, I think we operate with quite a bit of level of sophistication, I would say, in comparison to a lot of the other counties across the world, and based on what I've seen. And it took us quite a few weeks before we got the drive-through testing at the Milpitas Sports Arena. And so that was a good story, but I wish, our system could be a little bit more agile and adapt to that. Any comments from Harsha, from Daisy? So actually, let me share something here and let's talk about it. Yeah, go ahead.
Sure. No, go ahead, share, Rishi.
No, go ahead, Harsha, let you finish.
Okay, definitely. What we have done, we could have done much, much better. That's no doubt. More than 65,000 deaths. That's not what nobody had expected that in the system. And as you know, I mean, we all know that this is the highest spend that we do for the medical care in United States. And despite that, the care is not good. So we have been talking about this for a long time, the rates of death in the newborn, the rates of death in the maternal death rates. I mean, there are a lot of other things that we are not at the top-notch number, and there's something definitely a deficiency in our system. So it's definitely a learning, a lesson for us.
Absolutely. So let me just share this this data from our county, and if I can, okay, here we go. So you can see, how our curve is looking like, and this is the cumulative confirmed COVID-19 cases that we are tracking, and it's still sort of seemingly it's maybe leveling off right now, and but when we look at the number of cases, we just saw a spike over the last couple of days. There was a big spike in terms of the number of cases. And, I think a key indicator is basically this one, currently hospitalized COVID-19 patients. And I wish there was a chart here that showed, the progression of this particular number. And I don't see that, but the state of New York tracks this very actively. They show how the number of patients have gone up or gone down over time, because that sort of indicates to you how ready. In fact, this particular chart is essentially looking at hospital data, right? But the question is, if you have been hunkered down for 8 weeks now, why do we have a spike? Now, okay, somebody is asymptomatic and now pretty much everybody's testing. And so the test is coming out to be positive from, because if they were a carrier once and they decide to go in for testing, then they would show up as positive, right? So maybe that's rolled into the number, but is there something else going on where our shelter in place is not working? And whenever we are out there in the grocery stores or whatever we are doing, I see people in the grocery stores not wearing the masks. And so is that a problem, in terms of, we haven't really been so, regimented with respect to enforcing the lockdown compared to some of the other countries of the world. We are a little bit too relaxed over here. So any comments on that?
Yeah, I was going to say that you can only hold a population a certain amount of time before people are not going to take those cautionary things seriously, especially in areas where if you don't see it, it doesn't exist. And especially when you get out to the suburbs area, where you don't hear about your neighbor going into the hospital or something. It's 5 or 6 degrees of separation, and on top of that, you're hearing other people who went to the ER and say, "Oh yeah, it was completely empty," and no one was worried, and that information spreads like wildfires. And so people tend to go, well, I don't know what the governor is talking about. I'm going to just do whatever I want to do. I'm not sick. I'm fine. And, that really is going to play a huge part into, how people are going to get infected in the future. So, I mean, I think it's hard to tell a large population that, every week they're looking forward to the next week saying, okay, now I get to go and have my original life. I can go to the movies. I can go to watch that game, or I can go to the grocery store and not have to worry about, or I can hang out with friends. And then to have somebody else say, nope, it's going to be another 2 weeks. And then you wait for those other 2 weeks to go by. And then it's going to be another month. People get discouraged. And when you have discouraged people in the population, that's going to change for resistance. And that's what's happening across the board with, or the United States, with protests and people saying, I'm fine, I don't need to do this. This is for other people. This is, let the young people work, let the old people stay at home. I mean, that's been a lot of information that I'm getting from, the hospital setting, as well as just being in clinic. So it's really hard to fight the fight when you're saying, but look at the data, look at what's happening in the rest of the world. Well, it's not happening to me, so I don't care, and that is, I worry, and I'm also very exhausted. How many times I've been saying to other people, really, you gotta social distance. You can't make these mistakes because you know what? Maybe you won't get it, but somebody else will get it. And then I'm gonna have to see it. And I'm gonna have to see 10 other people for it. And I'm gonna have to witness my colleagues getting sick because they're trying to help you guys who don't think that they're gonna get sick. And it's just very, you know, I'm frustrated, super frustrated. And I'm not the only one. You have so many people out there that say, you know, whatever you guys are doing in terms of people and their quote unquote bad behavior is kind of a slap to everyone else that is working on legislature, that's working on testing, that this is a real thing. And it's almost like I wave my white flag, you guys win. I don't, you know, I'm going to end up not caring anymore. And that's when you have a huge problem.
So my comment to that is that, firstly, some of the cases you're seeing increase is because of testing. And as you said, the rate of hospitalization would be a better indicator. Or even better indicator would be correctly attributable deaths to COVID, because that would tell you that so many people have died and so many fewer people have died. That would be somewhat reassuring to people to know that that is truly some semblance of control over this disease. As far as people, you know, it's an analogy. I treat cancers, and some of these cancers are now readily treatable by pills that you know, you can control it. But when people are sick, they take the pill, they start to feel better, and then they keep taking it. After 2 or 3 months, they wonder, why do I really have to take the pill? They forget that their cancer is controlled because the pill is on board, and compliance falls off. So we find 100% compliance in the first 1 month, then it goes down to 90, and sometimes as low as 60%. And that 40% can be a game changer in an epidemic. And that's the kind of thing we probably will see here, because it's a domino, because people go out, they think that the restrictions have been eased, which means that it is less contagious, and that means it's no longer a problem. And they stop wearing a mask, they start hugging, they stop washing hands, and then you have a huge second wave, and that actually could be a bigger blow to the economy, the second wave, than even to the health of the country, frankly. But that would be really demoralizing, and that's happened before. And as one of the previous participants in the talk said, that those sections of population that were able to influence control over themselves are much tighter, in the long run did better economically than those that did not. And that's a message that will keep having to come and reinforced by whichever authorities. This has happened in the past. We have precedents. So just because a phased release of restrictions has happened does not mean that we let our guard down. And that is something is very important. And we understand that almost to some degree we are facing these restrictions because we do not have the means to sustain a lockdown for much longer, because we do not have that economic depth as we thought we did. We do not have the resources. And unfortunately, we do not have the testing which would have allowed this to happen in a much better way. But that's something people will have to understand, that if we let our guards down, and it's not just for ourselves, we're going to pay with the price of the vulnerable, the elderly, the sick. They are so that's something we need to understand.
Yep, very, very, very true. Very true. When we look at the context of the Spanish pandemic, the Spanish flu, you know, how it ended up spiking once again in the Bay Area. And that's my big fear too. You know, if we roll this, try to get an open economy too soon, we might have to deal with that situation. Comments from others?
Hello, everyone. I think a lot of the problem we have with containing it in America comes down to American identity, right? So we're much more individualistic culture, whereas we see, if you go to like the Asian cultures, even Europe, they're much more collectivist. They're much more willing to listen to their authority figures, and we still have that sort of Wild West attitude. So it's gonna be hard to that's the trouble we're seeing, is reconciling who we are with what we need to do to actually solve this crisis. And I mean, if we look at history, like with the Spanish flu, it says that a second wave is coming, but we're gonna have to find a way to reconcile our identity with what we have to do. And I think also a lot of people, especially middle class and lower income people, feel left behind by the government because they're being told to stay inside, but they're not seeing the help that they need to survive through this. So the longer this goes, I think the more people are gonna try to force the issue of opening up.
Well, I share the same frustration with the providers here. I mean, it's really hard for you know, from the medical standpoint, you know, keep seeing the same thing. And with the surge, what I'm more concerned about is the flu in this flu season coming in. You know, it's gonna be, we see a lot of patients with the viral upper respiratory infections, and it will be very, very confusing if there is a second wave that hits the same time as the flu. And in that case, we do the testing for rapid strep as well as for the flu test. And that will be economically very confusing for us. And with the shortage of PPEs and, you know, even the shortage of testing kits, it's really hard. So that is a message, you know, we want to make sure that people, even when the phase 2, phase 3, it's very, very important to follow the social distancing guidelines. Still very important to follow. If you're sick, don't go out, stay home, don't go to work. You know, those type of things are really, really important to make sure we don't hit the second wave.
Very true. Very true. And, you know, when we look at what we are talking about is the fact that, you know, what we alluded to was we weren't as resilient, you know, to handle the economic challenges that a pandemic like this imposes upon us. There are people who are suffering, who don't have a source of income. Perhaps the basic necessities like food is there, but housing, which is already super expensive here in the Bay Area, you know, how do we get through that? And when you look at the stimulus package, I don't think so. It really reached out to the people it was intended. You know, many of the larger enterprises got a hold of that money, and that should not have happened. So the distribution model was flawed, and we didn't quite do a great job of that. And then when you look at how Ehsan, he talked about the wild, wild west, you know, we are a very individualistic society, and we may not respond to authorities. Like when you look at contact tracing, you know, there's a huge pushback on my social media that why would I ever give away my information to big brother? You know, they're always watching you, and I don't trust them. What will they do with my data? But it's a different world, and we sort of will have to make compromises. And then I totally hear that the frustration is mounting. You know, Dr. Scarlett MacCallum referred to it, where, you know, when you hear all these sort of, you know, drinking the wrong sort of Kool-Aid, the feedback that we're getting from people, and it sort of doesn't make sense. Aren't you reading the news? Don't you see the data? But, you know, they are reading the wrong kind of data. And there is also the gloom and doom, the conspiracy theorists that are out there talking about their own world, and which makes it very confusing in this age of social media. Everybody has access to all sorts of data, which creates a lot of confusion in people's heads, right? So how do we get through that? It's going to be difficult. It's going to be difficult, but, you know, we are sort of taking baby steps here in California. And, you know, my sense is hindsight will always be 2020. We can look back and say, why did we do this? Why did we do that? I believe we are making the best choices that we possibly can, based upon data that we are seeing, based upon data that is coming at us, based upon what we know of this pandemic. You know, once in 100 years, you know, we are doing the best we can, and we will get through it. And hopefully we'll see the light at the end of the tunnel very quickly. And one fine day, everything will be back to square one. We'll have a good economy. We'll all be a little happier with the daily stress of what the life imposes upon living here in Silicon Valley. But that's what we are hoping for now. You know, this is the new norm, which is sitting at home and doing what we can. So everybody is ready to get out and go through a slightly stress elevation, but it'll all be good. So I really thank Dr. Daisy Scarlett MacCallum for joining in, Dr. Harsha Ramchandani, Dr. Rajesh Behl, thank you so much for taking the time. I appreciate you spending time with us. And we'll get back together next Wednesday once again, and we'll talk a little bit about some of this evolving landscape. We'll have perhaps a new set of data, and we'll dig into some of these elements. So thank you again for spending time, and enjoy the rest of the evening.
Thank you. It was a pleasure.
Thank you. Have a good night.